The million-dollar question right now is how much burden of these conditions, these lung diseases, are we going to see in 20 or 30 years of vaping?
More kids are vaping in Washington, and many of them are doing it in school. Now, the state legislature is trying to make it easier for schools to stop them. Hunter Bertram is here with how the new bill in the legislature could help.
Yeah, Derek, over the past decade, there have been a significant increase in the number of young people who are vaping. This trend has become a cause for concern, and some schools are installing vape detectors to catch kids in the act. Some schools in the inland Northwest have installed detectors like the one you just heard, but they're expensive. Spokane Public Schools paid over $100,000 to install them, and not every school district can afford that.
To date, we haven't had vape detectors. Really, it's an expense thing, and there's a lot involved in getting them installed.
Lindley is a principal of Bowdish Middle School, a part of the Central Valley School District, which does not currently have the detectors.
Well, having vape detectors would help us just be more aware of when it's happening. We could have more immediate responsiveness to the situation, so we would be informed immediately. We could intervene.
A bill introduced by the state of Washington's Office of the Superintendent of Public Instruction intends to provide money for these in all Washington schools. The detectors would be funded by grant money, requiring each school district to apply for the funds.
We want kids to make healthy choices, and systemically, we want to create change for kids where they don't see vaping as an alternative at school.
Gosh, I mean, we've done this before, right? Tobacco, cigarettes have kept us in business as lung doctors, and I think that we're fooling ourselves in saying that these vape devices aren't going to cause the same kind of problems down the road.
Part of the immediate need for these detectors in school is to curb addiction, as Dr. Arthur worries it goes beyond lung health.
You know, there's the concern about lung health and breathing, but then there's the concern about brain health and development and mental health and everything else, and that's just as serious in my opinion.
Dr. Arthur also said that already the effects of vaping is shown in youth with asthma and has increased anxiety levels amongst users. As for the bill, it's still in the early stages and has more discussions to go through before approval.